Okay, this is my second attempt for this speech practice. I've gone through all of my settings to make sure that my audio is working, and I've done two um, sound checks and played my videos back, and it seemed to work. So I'm hoping that this is better and you guys can hear me this time. Okay. My head hurts. It must be a tumor or an aneurysm. I have a pain in my leg. It's a blood clot. My heart skipped a beat. It must be a heart attack. These are common thoughts that seem very realistic to someone who is struggling with health-related OCD. As someone who has been diagnosed and lived with the disorder my whole life, I have grown more interested in learning the clinical reasoning behind why these thoughts occur and how they can be managed and treated. Health-related OCD causes debilitating fears they cannot let rest even after medical testing and doctors' expertise. There are countless hours of internet surfing to try and find answers or even a smidge of peace of mind. Countless doctor visits and sleepless nights as well. I will be diving into the depths of the disorder to draw more awareness to the matter. My hope is to educate my audience so that they may be empathetic to someone struggling with OCD. Health-related OCD is a condition that causes constant thoughts of having a serious illness. The International OCD Foundation states that 2 to 3% of the U.S. population is affected by OCD, and many of those people experience health-related compulsions. For someone with this condition, small and normal bodily sensations can feel like a medical emergency, and most of the time they do, unfortunately. A simple headache can be interpreted as a brain tumor, and a minor chest pain can feel like a heart attack. This disorder is especially difficult because these thoughts do not go away very easily at all. Fears can still persist even after medical testing and doctors reassuring that nothing is wrong. The brain continues to question, what if they miss something? What if everything's fine right now, but something develops later on, and then I'll have to go redo the test? This constant doubt is what keeps the vicious cycle of OCD going. Giving into these compulsions feed it more. Health-related OCD can have serious impact on a person's daily life and mental health. According to psychologist Stephen Phillipson, individuals with health-related OCD often experience ongoing fears of serious illness even after medical reassurance. The anxiety that develops with this often leads to compulsive behaviors, such as repeatedly checking for heart rate, constantly monitoring your breathing, and scanning the body for unusual sensations. This constant checking ultimately reinforces the anxiety, making the cycle of compulsions stronger. Struggling with this for long periods of time can become both mentally and physically exhausting. The mental load of it can cause stress, sleep issues, and difficulty completing normal everyday tasks. However, it is very important to know that health-related OCD can be treated and managed. One of the most effective treatments is CBT, also known as cognitive behavioral therapy. This type of therapy helps individuals recognize unhealthy thought patterns and learn how to challenge them in a more realistic way. Exposure and response therapy is another effective approach. This method gradually teaches individuals to face their fears without engaging in compulsive behaviors. Oh, I forgot. Shoot. Okay, never mind. I put it in a different place. Okay, sorry. This method gradually teaches individuals to face their fears without engaging in compulsive behaviors. Part of the therapy is practicing sitting with the uncomfortable thought and responding with uncertainty, such as maybe, For instance, if your brain says your head hurts, you have a brain tumor aneurysm, you say, maybe so. And that's part of the therapy. This approach can be overwhelming to some, including myself, as it is my least favorite therapy to deal with health-related OCD. The process is very grueling and difficult, but over time it helps the brain retrain itself to tolerate uncertainty and reduce anxiety that comes with it. In more severe cases, doctors may prescribe medication to lessen the intensity and the anxiety. To lessen the intensity of intrusive thoughts and the anxiety. To make daily life easier for the individual. Often, a combination of therapy and meds are most effective. Health-related OCD can have so much control over a person's thoughts, turning normal bodily sensations into persisting fears. But with support and the correct treatment, it does not have to control one's life. By becoming more aware of this disorder, we can become more empathetic and remind those that struggle that they aren't alone and help is always available.